the traumatic brain injury cannabinoid, IHL-216A, is of particular importance to me because it's very linked to my background as an anaesthetist. So this is an inhalational drug. It's a mixture of a volatile inhalational anesthetic agent. It's called methoxyflurane, which is commonly used, and in addition to cannabidiol or CBD, which again has been commonly used. So methoxyflurane, for those who know, is the green whistle that you get in the ambulance after you have any form of trauma. It's been safely used in hundreds of thousands, if not millions of patients, and it's actually been off patent for about 50 years. There's currently an Australian company that is the global owner of a patent based on the delivery device, but the actual drug and the contents itself are freely available off patent. IHL owned a patent around the combination of all volatile anesthetic agents being used in conjunction with cannabidiol. So that's a very powerful space. So just moving on to this, the novel cannabinoid therapy research is all being done at Swinburne, which is the primary cannabis research unit Australia-wide. Traumatic brain injury is a massive disease problem. It's about 10 million deaths and/or hospitalization annually. So it's a very, very significant disease. As of today, there is not one approved pharmacological treatment for head injury. And this is very significant for young men who play sports and road traffic accidents, motorbike drivers who commonly have significant head injuries on the roadside. Currently, the primary treatment if someone has a head injury is surgical decompression. So if you have brain trauma, what typically happens is the surgeon will cut out a section of bone, a craniotomy, and release the pressure around the brain to stop the brain swelling and effectively reducing the ability to perfuse the brain, send blood to the brain. And that's a pretty significant operation which carries significant morbidities associated with it. If there was a pharmacological treatment that could be given immediate after the primary head bump to stop the brain swelling occurring, then that would be something that's a very valuable part of the doctor's armory of drugs. So this is where IHL-216A is the drug of choice, and this is what we're researching. Now, how does a head injury cause damage to the central nervous system? So, very quick summary. There's a primary insult to the head, blunt trauma to the head, road accident, head bang, however it happens. Once that happens, there's bruises, which is known as, the medical word is contusion. There's blood vessel disruption, and there's general blood around the meninges of the brain, which is the coating of skin around the brain. That is very irritant on the brain, and that introduces an inflammatory response, and your body tries to send a lot of white cells to heal that. As your white cell response goes up to the brain continues to increase the amount of inflammation and causes further brain swelling. Now, it's the white cells that arrive and try to fix up all the blood and debris around the brain, and it's the increased pressure of all the new fluid that's arrived there that causes the damage. So it's actually your own body creating damage to its own brain. And in the process of trying to heal what it interprets as foreign material. Now, if we could, between the time of the primary trauma and when this inflammatory response really kicks off, if we can give an intervention at that point, we can hopefully subside or even prevent that from happening. And that's really where this drug is being tested. So without going into too much medical mumbo jumbo, the purpose is to turn off the inflammatory response, give the brain some neuroprotection, and also reduce the amount of increased pressure or cerebral edema around the critical brain tissue. So that's the sequence of events. Initial primary head trauma, you then get disruption of brain tissue, disruption of blood vessels, brain swelling, and diffuse axonal injury. And then it's the disruption of the blood-brain barrier that starts causing major issues where toxins can now cross straight into the brain. Chemotaxis means attracting white cells and inflammatory mediators to the brain. The raised pressure within the cranium, so the head is a fixed box, and if the pressure increases, the body loses the ability to send blood to the brain because of our bony skull, our bony cranium. And then we also get the symptoms of this diffuse axonal injury: confusion, headache, vomiting, drowsiness, typically after that major head injury. So the idea is the drugs are given somewhere between the primary head injury and before all these events happen, which ideally should be in the first few hours after the primary head injury. So ideally at the the sports field side, in the emergency department when the patient presents after their head trauma, and we can try and obliviate or even remove the white cell response and inflammatory response happening. So, believe it or not, physiologically in your body tries to prevent that from happening with endocannabinoids. And endocannabinoids are neuroprotective already. So they've already been shown that they will turn off the electrical system in the brain, they will reduce inflammation, and they'll stop further blood vessel damage. The problem is there's just not enough endocannabinoids and the response is too late physiologically. And this is why giving external cannabinoids, whether they're phytocannabinoids or synthetic cannabinoids, if you can give them fast enough, if they can cross into the brain, across the blood-brain barrier, you may be able to terminate this inflammatory process which is causing the damage. Now, there's been a lot of evidence to support why cannabis may actually be effective for brain injury. So there was a study, quite an iconic study in 2002, which showed in mice that brain ischemia is reduced with mice that have true cannabinoid receptors versus ones who didn't have the cannabinoid receptors. So that was quite interesting. And then that led researchers to move on to a proper phase 2 study, which showed in patients that after severe TBI, that if they were treated with a cannabinoid inducer, there was some improved prognosis of survival. And then the third study is probably the most interesting. So this is a huge study that was done, and it was a retrospective analysis of all patients that have presented to trauma units, usually from road accidents, and who've been intubated typically after their road accident. And what it showed is those who had a positive urine dipstick for cannabis had an improved survival rate. So this is, street cannabis. This wasn't medical cannabis. So everyone started thinking, hang on, so these are guys who probably aren't healthier than normal people. They just were, cannabis smokers recreationally. But after a head injury, they were more likely to survive than those who didn't smoke cannabis, who had a negative cannabis screen. And then 2014 was when things really started going. People started triggering, actually, well, maybe there's some science to this. Maybe somehow cannabis is protecting the brain, we just don't know it yet. And then the Israeli Defense Force actually made a very significant step, and they made high-dose CBD, low-dose THC now the first-line treatment for in-the-field head injuries. And then in 2017, ASADA, which is the Australian Sports Anti-Doping Agency, they removed the ban on cannabidiol, saying, actually, it's probably a good thing if players are using this because this will prevent head injuries. And in 2018, WADA, which is the Worldwide Anti-Doping Agency, they removed the ban on cannabidiol. And 2019, so now in most competitive martial arts sports, people vape CBD before, after, during, anytime they can to prevent head injuries. And that's very, very commonly used. So Nate Diaz has got his own brand of CBD. If you're familiar with the UFC, Nate Diaz has got his own brand of CBD, which he uses specifically for preventing head contusions, head injuries after getting beaten up in a ring. And then the UFC is actually commencing their own trial on using plain CBD for the prevention of further head trauma as well. So it's currently very topical. We believe we're the first people who've combined a volatile anesthetic. Well, we know we are the first people who've combined a volatile anesthetic with a cannabinoid to create this novel drug. So how will our drug work? So the current treatment, if someone had a significant head injury, the current treatment is usually you'll go to an emergency department, and if that head injury is showing worsening swelling of the brain, what will typically happen is the doctors in the emergency department may give you some drugs to try and reduce further swelling. And if it's very, very critical and they feel that the brain swelling is going to eventually make you lose consciousness or cause permanent damage to the brain, they might actually induce anesthesia. So for significant head injuries, one of the primary treatments is giving an anesthetic agent. And the way I describe that is that basically relaxes your body, it reduces the amount of stress in your body, and it chills out the brain. So it reduces the amount of electrical activity in the brain, reduces the amount of blood flow going up to the brain, causing that brain swelling, and just calms the whole body down and stops that secondary injury from happening. So that's already conventional treatment. So when we combine these two items of information, it now seems very obvious that giving a volatile anesthetic in conjunction with cannabidiol is a solution. It's just that no one had proposed it before, and delivering those two drugs simultaneously has always been a challenge. So what IHL 216A is a novel methodology for delivering both of them at the same time. So estimated market size, we think there's 10 million patients globally who are affected by moderate to severe traumatic injury per annum. It's a greater than 1 billion potential market value. It's a prophylactically administered drug, meaning anybody who's had a head injury should be taking it prior to them developing any significant medical symptoms. So the idea is that you overtreat the groups. You try and give it to as many people who have had injuries to prevent them developing significant neurological consequences. There's no FDA or TGA registered drugs for this, so we're hoping that we can get an orphan designation or some kind of fast track or priority licensing from the FDA, and we're aiming to be globally the first line therapy for traumatic brain injury. So I think that's a very exciting prospect for us, and we're really looking forward to commercializing that.